Come here. We'll get you cleaned up, okay? It's okay. Are you okay? Hey.
29-year-old special ed teacher coughs up blood all over Corky. No dyspnea, no weight loss. Why are you smirking?
Never thought I'd see the day you were taking orders from Cameron.
Cameron's in charge?
When did that happen?
You're gonna destroy her, aren't you?
I am going to do my job. If that involves leaving her a rotting pulp.
Cameron's gonna mark her territory. She'll probably overcompensate and destroy you.
Bleeding ulcer.
Scope of the stomach and lungs were clean, yet she continues to spit up blood from both her stomach and lungs.
Not slowing up. No sign of clotting.
So there is something wrong with my blood?
Don't worry. We'll run some lab tests to find out which clotting factor's off, and then...
I'm not worried.
Must be one hell of a happy place.
It is the blood, but the clotting proteins aren't the problem.
It's her platelets. Look like they had bite marks on them.
So now you're agreeing. Either you folded because I gave you crap, or you broke up.
We disagree, you blame our relationship. We agree, you blame our relationship. Don't you see a problem there?
Yes. Don't you?
Could be lymphoma.
Not with normal LDH.
ITP fits. We should start her on methotrexate.
Absolutely. And total body irradiation.
Because she failed the bleeding time test?
TBI will promote cancers, kill her digestive tract.
Don't forget, stop her from bleeding into her brain.
It's premature, reckless, and potentially lethal.
True. Must be somebody's job to stop me from being reckless and irresponsible. Nobody can stop me from being premature. Got a patient with ITP. Need to hit her with radiation.
I'm gonna have to call you back.
Methotrexate.
Good point. On the other hand, if she bleeds in her brain, she's gonna need a special ed class of her own.
Fine.
Really?
Yeah, if you think it's right, do it.
Some people thought you were gonna be brutal, marking your territory.
Who?
Nobody. Just because I call him nobody doesn't make me a racist.
I'm not gonna play games. If you come to me with a request and it makes medical sense, I'll say yes.
So, how long until we start the procedure?
We already started. Told you you wouldn't feel a thing.
You should lie back. Just stay real still.
I'm afraid there is someone sitting next to you. Oh, for God.
I have to pee. Can we, call a timeout for a minute? Let me go to the bathroom?
Yeah, sure. We'll just start up again when you're done.
Thanks. Sorry, I didn't realize I had to go.
No problem.
Sarah.
No pulse. Get the paddles.
Clear.
Got a pulse. It's not ITP. She clearly doesn't need fake radiation.
No structural defects in her heart.
What about a calcified valve or a patent frame and ovally?
Transthoracic echo and bubble studies show nothing. Her heart's clean.
The patient said she had to go pee. Maybe when she got up, she started to urinate, increased the vagal tone, caused arrhythmia, and stopped her heart.
Who has to go pee in the middle of a nuclear procedure?
It wasn't really a nuclear procedure.
She didn't know that. People don't die from peeing.
Heavy metal, toxin.
Drugs or alcohol.
Or her own body's making a toxin, cold agglutinins. Abnormal protein gets activated by cold temperatures.
Like the classroom with the broken heater and the cold metal table in the procedural.
Oh, for God's sake, get a room. Immerse her in an ice bath. Cold will activate her cold agglutinins,
Causing her heart to race.
confirming our diagnosis.
And giving her another heart attack.
Lucky for me, there's a flaxen-haired maiden who loves to say yes.
You come to procedures now?
Only the ones that might involve stopping the patient's heart.
Cameron tell you to be here?
Shut up.
Tell me about Jonathan. How'd you get him to come out of hiding?
He was extremely sensitive to touch. Yet he had a tactile fascination with newspaper. I mean, he wouldn't read it. He would just touch it, crinkle it. I thought maybe that was a way in. Paper mache, and... Oh, And it was. He let me into his world.
Please tell her that talking will ruin the test.
All the kids, I tried to become a part of them and then have them become a part of me.
How much longer till a heart attack?
I wanted to be a doctor from the time I was 8 years old. Never wanted to be a pediatrician, though.
Now they're both talking.
Well, I wanted to be a sociologist. I was supposed to observe a class. I was sent to room 214, but I went to room 241 instead. It was a special ed class, and I just felt at home.
Time. Heart rate's normal.
You can get out now.
It's not cold agglutinins.
I'm not surprised. She obviously has brain damage. Seriously.
The screwed up numbers and forgetting to pee points to her being a human being. The platelet dysfunction and cardiac arrest points to a pancreatic tumor.
Or multiple sclerosis. The brain is like the internet. Packets of information constantly flowing from one area to another. Plaques in her brain, like a bad server, slow down the flow. If it's in the parahippocampus, it'll spread to the brainstem, which means it'll be the lungs next. Brain biopsy will show you the plaques.
Or we could not cut into her brain. It's just her pancreas. We should do an ERCP.
Well, we could settle this with rock, paper, scissors, but unfortunately, there are people who adjudicate these disputes. On the other hand, cutting around his endoscopic ultrasound didn't find PEEP.
So disproving it's her pancreas proves it's her brain.
Yes! You used to do this job, remember? That's what you used to pass for evidence.
Now I do this job. You brought me 3 dead bugs and a runny nose.
I can't find you the proof you want because it's trapped inside her head. And the only way I can get at it is to cut it open and rip it out, which is apparently the one test you won't let me run. So either I do this or I do nothing.
What do you want me to do? Say yes just because your house?
I'd certainly like that, yeah.
Dr. Cameron, you're actually assisting him with this?
Yes, because I'm actually familiar with this case.
Well, I'm familiar enough to know that cutting into this woman's brain is not necessary.
Is she serious?
She's certainly not funny.
Oh, that is so annoying. Can you make it stop?
Baby's crying is annoying you?
But her BP's 80 over palp. We're gonna have to stop.
That doesn't make any sense.
The fact that you're wrong doesn't make any sense, or the fact that I believe that you were right. BP's still dropping. She's gonna stroke.
Giving her 10 more cc's. I'm putting an end to this.
Okay, Rachel, quiet down. I need you to be quiet.
Please turn that phone off.
Why does the baby annoy you, but no one else does? And you're right about her, but
I don't know what you want. I will give you anything that you want. I don't know what it is. Tell me, please. Just help me. Please. Really? That worked.
She's stable. We're finished here. Close her up.
So I can just live spleen-free?
Plenty of people live perfectly normal lives without.
spleen's fine.
It's not her brain.
Of course it's her brain.
You looked at her brain. You took off her skull. You found nothing.
Didn't look in the right part. Didn't look in the heart part. In the womb, blood has to bypass the lungs since they don't work yet. When we're born, we take our first big breath, lungs expand, and the ductus closes. Yours didn't.
She has a patent ductus arteriosus.
When you get stressed, your blood pressure goes up, forces open the ductus. Blood takes a little detour, makes a leak from your nose, your stomach, your lungs, and more significantly, keeps it flowing to the right side of your brain and away from your left. Which means that when you get stressed, you get unstressed. That's why you're so good with those annoying kids, and why, when your blood pressure dropped, you were able to identify Cuddy as an annoying human being. Good news is, we can fix the heart. Bad news for the annoying kids. Right side pain, vomiting. Now, a lung that gets traumatized without any trauma. Sounds odd. Probably is odd.
We should discuss this, then call her back.
Well, it's fine. I made sure we got the South Pole long distance plan. Your latest kidney function test shows
Well, I know what it shows. I ran it.
the more you interrupt, the longer my grandstanding is going to take.
Since when do you let patients participate in differentials?
Since the patient and her doctor happen to be the same person. Your kidney function is still declining, means you have a kidney problem.
But not one that needed antibiotics. Makes us equally wrong.
No, makes us both wrong, not equally. You were at least 6 wronger. They run a PPD before you shipped out?
On me and everybody else here, it's not TB.
Excuse us a second. Cancer explains her symptoms. A tumor in her lung or kidney that threw a clot to the other organ.
And you're worried the tumor might overhear and realize we're onto it.
Cancer's a hard diagnosis for patients, even when they're not in the South Pole. We should figure this out. Maybe bring Wilson in.
Obviously, you two think I'm in bad shape.
Only if you count the tumor.
House.
Probably in your abdomen. But you don't have any advanced imaging equipment. You also don't have a surgeon to biopsy it, any stains to use on the slide, or an oncologist to analyze it. Too far away to hold their hand.
I have cancer.
Possibly.
Since the only imaging equipment you have is X-ray, let's start there. X-ray your entire body.
I'm starting with the anterior cervical nodes.
Hey, turn your head. Locate the SCM muscle.
I know how to find my lymph nodes.
They teach you that before or after the class on fondling your inner child.
No swelling, no tenderness, and I can hear that, House.
Just thought I might help you relax. Anything in the axillary nodes?
All clear. Both sides.
Yeah, slide your hand to your sternum. Probe for nodes, moving slowly downward.
Down to what, House?
Sorry, can't hear you on account of your heavy breathing.
I'm supposed to be on oxygen, you tool.
Hold it. Fingers didn't go quite as deep. Feel that node again.
It's swollen.
Looks like you're doing a biopsy.
Based on this slide, you do not have cancer.
Oh, thank God.
I do see some inflammation, which could mean...
Kate?
You all right?
My left side, it hurts. It's the same pain that I had on the right.
Your other kidney.
No, I hope it's something. It's maybe. Oh no.
There is another test.
I think Foreman may have just broken up there. What he actually said was, there is no other test.
If you have an autoimmune disease, exposure to the cold should decrease your kidney pain.
If I go outside, we'll have our answer. And you knew about this.
I rejected it because if you're frozen solid, it's hard to get the needles into your arms.
How long do I need to stay out?
At least 5 minutes.
8 minutes outside would kill a healthy person. And healthy people don't suck on oxygen masks. Healthy people can pee.
I'll go get Sean. Have him come with me.
Just take the prednisone.
Once I come inside. If it's autoimmune.
Are you all right?
Oh, I'm sure she's just fine. Kate?
We could talk the mechanic through the test.
Too complicated. Unless he's thirsty.
Drink her urine. If it has a strong, concentrated taste, it means the problem's in her kidneys. Watery taste means it's her brain.
And then you can fix it?
Let's say yeah.
How do I get the urine out of her?
We'll take a straight catheter and insert
Those
it.
are your only questions? Not, is it safe? Or is there another way? Or are you out of your minds?
You wouldn't ask me if...
Wait a second. You're in love with her. That explains why you're so eager to get her naked, then have a drink. Because most guys like to go the other way around.
Why do you care how I feel about her?
Because now I know that I can get you to do anything to save her. Milk, lemonade.
It tastes kind of watery.
That's bad news.
Either increased intracranial pressure or something's wrong with her hypothalamus. How do you figure out which one it is?
We don't do anything. You're gonna drill a hole in her skull. If she regains consciousness, it's increased intracranial pressure.
And if it's the other thing?
She'll die. But if it's the hypothalamus, she's dead anyway.
If the problem is the pressure in her brain and I fix it, is she gonna be all better?
Nope. But it'll give us more time to figure out what's wrong.
I have to get someone else. I can't do this.
You love her. Right? You'd do anything to save her.
Not this. I can't do this. If she dies because of something that I did, then
Listen. I am not going to let you hurt her, okay? Now, please. This is our only chance.
Okay.
That was easy. South Pole Doc is out of her coma. And now we have a new symptom. Increased intracranial pressure.
Why are we out here?
That's the patient room. ICP plus kidney problems plus lung collapse equals...
The most likely suspect is a tumor throwing off clots.
We ruled out cancer.
But not clots. What causes blood clots?
Bacterial endocarditis.
Not without a fever.
Deep vein thrombosis plus an existing PFO.
PFO would have been discovered in her pre-South Pole physical exam.
What if the clots aren't clots? Atherosclerosis, fatty plaque builds up on the arterial walls, pieces break off, block blood flow. Explains everything.
She has 0 risk factors. Forget fat, think clots.
No.
You're standing up to me?
Maybe.
Just to clarify, you should do that when you're right. Sorry for the confusion. How could a
Could
clot...
be a different kind of fat emboli.
It's a perfect fit, except it's completely impossible. Fat emboli requires an unrepaired bone breakage. Between the x-ray and the exam, I've seen her entire... Take off her socks.
I could do it.
No, I got it.
Your toe is broken.
Oh my God.
Bits of bone marrow have been leaking into your bloodstream. Those fat emboli have caused blockages in your kidney, lungs, and brain.
It doesn't even hurt.
Cold numbs everything. Does a particularly great job on the extremities.
You'll need to close the break to stop the marrow from leaking.
This one you will feel.
Will you do it?
He drilled a hole in your skull after drinking your pee. I think he's up for this.
Grab the tip of her toe with your right hand, hold the brake with the other. On the count of 3, pull hard. 1, 2, 3.
Now splint your toe. You'll be fine.
Thank you, House.
Don't thank me. He's the one who saved your life.
What is this I feel? Why is it so real? What am I to say? It's only love. It's only pain.
Stevie, what's wrong? Oh my God! Help!
told you, they must be in a conference.
He's lying.
Leah.
He's Romani. A gypsy.
So you don't have a home?
Of course we do. What, next you're gonna ask me about dancing around campfires and stealing children? This is why I don't tell people.
They share everything with each other and nothing with the guys yet. The outsiders.
Sharing information with outsiders has not gone so well for my people.
But right now, you're making yourself more vulnerable by lying to us.
You can't go to my house. You'll pollute it.
All we're gonna do is look around.
Your presence is enough.
He's Romani. Apparently, they feel the need to keep secrets, so it's hard to know anything for sure.
Yeah, he's also a human being, which means you shouldn't be trusting him to begin with. Stop relying on his answers and find some on your own.
It's a deep vein thrombosis. The kid spent 16 hours in the backseat of an old pickup. Causes a clot and makes his way to his lungs. We should do an arteriogram, find the clot, bust it with TPA.
Or we can find the leak.
There's no leak.
Hey, you can't yell at a guy in a wheelchair. This is a slow leak. We gotta speed it up. Thin his blood, redo the venogram.
That could cause a massive bleed.
Excellent. Massive will be even easier to find. Pardon me. I guess you guys are gonna have to get the next one.
Nice flat.
Oh, no, I can't. It hurts too much.
I'm getting out.
It's our only chance to see what's going on.
If he moves, I could shred his artery.
Get it out now.
It's gonna be okay, Stevie. Just inject the dye.
The dye's going into his liver, but it's not coming out.
The clot's gotta be constricting the flow in the hepatic vein.
It's not constricting it, it's completely blocking it. His whole liver's fried.
Something inside the liver is punching holes in the pipes. Blood bleeds through the opening, sticks to the intruder, forms a mass.
A clot.
A mass.
Cancer. That tumor could erode a blood vessel.
Well, so could a granuloma from tuberculosis to sarcoidosis.
Do a CT, MRI, sputum, and an ACE level. Excuse me. All right, purple coming through.
Wait. Is that a lesion?
Magnifying times 5.
It's a granuloma.
Means Wegner's is most likely.
Stevie!
Mom, is that you?
Hey.
Get him out of this now!
Your son is sick. The sign on the door.
No, the sign says no matter. We took everything off.
Says no admittance. What's wrong with our son?
We don't know yet. He's not gonna die, is he?
Your son is very ill. We're still trying to figure out why, which is why we need you to leave the room. What's with the clothes? You're not being discharged.
I know. It's my parents. They insist that I wear this stuff.
We insist on our own food, gown, and furnishings for a reason.
Hey, my chest burns. Are you sure the treatments are working?
Wegner's causes the body to attack itself. It doesn't get undone overnight. Be patient.
Where's your soup?
It's in the garbage.
It has willow bark extract.
Willow bark extract is basically aspirin.
Yes, for the fever.
He's already on meds, our meds. We can't risk any adverse interactions. We need all this stuff to go. We need to control this environment.
So do we. People get sick for a reason. Because something in their life is out of balance.
Dad, he's a doctor. He doesn't want to hear your talk.
Balance is just starting to be restored now that that girl is gone.
That girl took pretty good care of your son while you were away.
Yes, we can see that.
All this stuff may make him feel more comfortable, but it's not gonna...
How long is this treatment gonna take?
We should start to see some improvement in his liver function soon.
Soon. Very scientific.
I'm sorry.
I'll be back in a little bit to check on you.
Get out of our home.
This is not a home. It's certainly not.
It's our home as long as our son is here.
Mom, Dad, will you please just calm down?
You're not family. You have no right to be here.
What are you gonna do? Throw me out? You can't even touch the guy.
I'll touch you.
What is going on?
I'm the one who brought him here. I should be able to see how he's doing.
He wouldn't even need to be here if it weren't for you.
Right. I'm so unclean, I caused his liver to shut down.
Enough. No one is leaving.
He's our son, and we want her out of here.
It hurts.
Is your stomach again?
No.
What?
There's no way his parents are gonna let us near him again.
They won't be able to transfer him until he's recovered from the surgery.
You can add the surgical team to the list of people who won't let us near him.
Bleeds, clots, bleeds, clots. Spleen explodes.
We should test some Von Willebrand's.
Or just play tic-tac-toe. Okay, X's are bleeds, O's are clots. Started in the lungs, right? What do we do?
CT, sputum, 2 venograms.
It's 1 bleed, 1 clot. Then what?
Liver shut down, MRI, labs, treated with cyclophosphamide.
Whereupon he peed out 3 units of O negative. Another bleed.
Where is this going?
I don't know yet. What's next?
Bladder, kidneys?
High-resolution CT scan, UA and urine sediment.
GI tract.
You ran a small bowel in the OR?
The large bowel is fixed to the abdominal wall. I didn't run that.
Because there was no reason to. He hasn't been having any symptoms in his bowels.
Do a colonoscopy.
Because he's had no symptoms?
You lose your keys. First thing you do is look everywhere you might logically have placed them. When you don't find them, then you start looking in other places. The medicine cabinet, freezer, mailbox. You need to look in this kid's mailbox.
Why don't we x-ray his feet? They're fine, too.
Because we need to take the center square to block.
Okay, even if that did make sense, it's kind of hard to do a colonoscopy on a kid you can't get near.
He's in the ICU now. His parents only have limited visiting privileges.
I like that kid. He's got spunk.
A reflection?
No, it's something. Looks like a toothpick.
Are you sure?
He must have swallowed it accidentally and just figured he'd digest it eventually. You two were making out in the car. He must have folded awkwardly, pushed the toothpick through the wall of the intestine and into the lung. And it moved onto his liver and made its way to his bladder and spleen.
So that's it. He's gonna be okay.
Yeah. Small holes. It shouldn't take that long to heal now that we've got it out.
See? See what you did?
Me?
You hadn't been kissing him.
That's what you heard? It was the toothpick. It was that disgusting habit.
It
that
would have
you-
just passed right through him if he hadn't been writhing around. Isn't that right?
That's it?
Yeah, that's it. Wood absorbs water, becomes the same density as the tissue around it. That's why it didn't show up on the CT or MRI.
That's cool. I mean, not cool for me, but a lot of damage for something so small.
You know, the lab here, they have a paid intern position. It's usually given to one of the kids from the universities, but if you want, I could probably get you an interview. Yeah, some entry-level stuff, some gopher work, but you'd also have access to a lot of cool things.
Thanks, really, but I can't.
Yes, you can. Stevie, you're bright. You have more curiosity than 90% of the doctors on this staff.
It's not that. It's just... I go to work every day with my family, you know? People I've known my whole life. I don't want to lose that.
You can have both.
No, I can't.
Because they don't want to let you. They shouldn't be making you choose.
Maybe not, but they are. I'm choosing them.
Change is hard. Trust me, I know. But it worked out for me.
You're a successful doctor. Your name is on journal articles. I would love that. It's just... I see you with Doctors Chase and Cameron, and y'all got empty ring fingers.